Bismillahirrahmanirrahim, Assalamu alaikum and welcome to Diplomatic Enclave. I'm your host Omar Khalid Butt. In this series, we talk to different ambassadors, heads of organizations, as well as prime ministers and presidents to talk about what they are doing in their respective country, on their respective organization, and how their collaboration with our country, Pakistan, is going on. Today, we've got a very interesting and important guest with us. Drugs and crime are two things that are affecting the entire world, this region in particular, and other regions across the world as well. There is one particular organization that deals with this, and that is the United Nations Organization on Drug and Crime. And the UNODC has been in Pakistan since quite some time. It has been collaborating with the different governments in Pakistan in order to curtail drug use and crime as well as in other different countries. Now, the UNODC has taken out its annual report for this year. In the world, it was released on the 27th, and in Pakistan, it was released on the 29th of June. What are the different components of this report? This and more, drug and crime. This is going to be our topic of discussion today, and we've been joined by, of course, the Pakistan head for UNODC in Pakistan, His Excellency Mr. Jeremy Milsom. Jeremy, thank you very much to have joined us.
Thank you. It's a pleasure to be on your show.
It's always a pleasure to have you here as well. Jeremy, when it comes to you and when it comes to Pakistan, since you've come to Pakistan, how A, have you found Pakistan as a country, and how B, have you found the response from the Pakistani authorities and the people as far as your work is concerned?
Well, it's really a pleasure and an honour and a privilege to live in Pakistan and to work on this particular mandate. By and large, I find Pakistan the counterparts here very strongly committed to the counter-drug and counter-crime mandate of UNODC. So, you know, my experience with so many counterparts at federal and provincial level in the many aspects of what we do on countering drugs and crime has been quite positive. I mean, I see the country as progressive in this respect and making quite some headway.
All right, Jeremy, when we look at what your organization does, it basically evaluates the drug and crime rate in the country and gives suggestions to the different governments in collaboration with them as to how to curtail them. Now, in that respect, on the 26th of June, every year you celebrate what is the International Day Against Drug Abuse and Illicit Trafficking. Why celebrate this day? Why have a day in this week or in the year for that?
Well, actually, it was a decision by the member states of the United Nations, so all countries of the world. There was a resolution, number 42-112, if I recall correctly, on the 7th of December 1987. The nations of the world got together and decided to assign a particular day to get world cooperation, world attention on the dangers of drug abuse, and to highlight that day and get world action and world attention once a year so that the threat would always be in people's minds.
All right. And what is the effect of celebrating such a day in Pakistan or across the world? What kind of response do you get from it?
Well, the actual day itself is the 26th of June. So on Sunday, the key counterparts here in the country, the Ministry of Narcotics Control and the Anti-Narcotics Force, held rallies and marches and sent messaging with, it involves galvanising the entire community. So it's government and all the departments involved, it's communities, it's students, it's families, working together, reminding ourselves how dangerous drugs can be, understanding the changes and the new threats, and making a commitment to have society safer and healthier from drugs.
That is very important. I think the participation of the normal public, people from the society, whether it be men, women and children, like events such as the cycle rally that is held almost every year and other events, kind of bring out that solidarity amongst different segments of the society and bring together the whole team and make them understand why we are doing this. It is for a certain cause. It is for reducing the use of drugs amongst different sections of the population and also the crime rate. When you hold such events, when you talk to people about the effects of drugs and the effect of crime, do you feel the information is disseminated at a right enough level? Do you feel more needs to be done from the UNODC and from the different governments, including our government?
Well, when it comes to awareness raising and advocacy on particularly on countering drug abuse, but also various types of crime, it sort of has to be a continuous process. So it's very positive once a day to have this key day to remind everyone and bring it to the attention. But it also requires constant and ongoing work by governments, by designated ministries such as the Narcotics Control Ministry and ANF, working in partnership with health and education to build messaging into ongoing awareness campaigns that continue throughout the year, but in schools as well, so that it's in the education system, in the curricula. Pakistan actually has been trying to make a difference on the global stage in this respect. A few years back, Pakistan organised and sponsored a resolution in the Commission on Narcotic Drugs to increase global cooperation on prevention in education settings. And that resolution was adopted by full consensus, and so there's been more action around the world on studying what's happening in schools, sharing information between countries, looking at new drugs coming onto the market and how it can be addressed. So there's a single day where it's highlighted, but the actual advocacy and messaging is something
the whole year through, basically.
Yes, yes.
The theme this year is addressing drug challenges in health and humanitarian crisis, and of course the message goes through the hashtag care in crisis. When you say challenges in health and humanitarian crisis, what do you exactly mean by that?
Well, each year there's a theme, and unfortunately in the world today there's many crises and conflicts, and also we're just coming through COVID-19, and so when you have conflicts and crises, people suffer more hardship, they're more stressed, and there's more risk that people will turn to drug abuse to deal with that stress. At the same time, during the pandemic, for instance, it was more difficult for people then to access services with lockdowns, and so there was a lot of innovation actually in health provision to help people. So it's to sort of be mindful of this issue and highlight that when we have crises, we have to be mindful that the risks can be greater, and to keep up our work to ensure that drug abuse doesn't get worse.
One of the challenges, and you yourself mentioned it, is COVID-19. Now, do you feel that COVID-19 has increased the rate of drug abuse, has increased crime directly or indirectly because of the economic situation that has underlined the crisis?
That's a very good question. And it has, I guess you could look at it from different angles. When COVID first struck, it did affect global supply chains and the way drugs are trafficked and marketed. But what we found was organised crime groups and criminal networks quickly adapted. So in the end, there wasn't much impact on the supply of drugs, and in fact, we saw an actually increase in drug seizures in this region during the crisis. In terms of the impact on people, we need to do surveys and studies and data to understand what's going on, and it's been quite some time since the last full nationwide survey here in Pakistan. The last one was conducted in 2013.
All right.
So in fact, this year we're going to start a new nationwide survey in partnership with government. So we will be able to get more insight into the impact COVID-19 has had on drug use and other factors as well. I mean, one important factor is that the level of synthetic drugs availability in the region has increased due to the fact that it's being now produced on a large scale in Afghanistan, and this poses a real risk and threat to Pakistan, and it's an issue we need to understand and we need to address it.
You talk of Afghanistan, we understand the situation that Afghanistan is going through, and also that gives rise to a lot of elements such as you've just pointed out, increase in drugs, increase in crime rate as well. Do you feel the UNODC can highlight this issue as it has been doing in the different international fora as well, so that the countries that matter, the countries that can pressurize Afghanistan, can work collectively with the UNODC in order to help it curtail the use of drug and crime?
Yeah, that's a good question. I mean, the situation since the change of governance in Afghanistan has been a challenging one. UNODC, we've developed a regional strategy called the Strategic Stability Grid. And what we're doing is, some things we can continue to do in Afghanistan, and we're doing a lot of humanitarian work and health and alternative livelihoods. But the work on drugs and crime, what we can't do in Afghanistan, we do more in the region. So we have a country program here in Pakistan, but we actually have a regional program covering West and Central Asia, which builds cooperation between Pakistan, Iran, Central Asian countries. And we're working through this platform to continue to have the countries to work together on the issue. As I said, unfortunately, in the last 12 months, we've seen an increase in seizures around the region. We've seen, it's a positive thing when there are seizures, because it's taking drugs off the market.
Of course.
We've seen large seizures in Pakistan and Iran, increases in Central Asia, increases in the Southern Caucasus as well. So it shows that the problem's still there, and it needs robust national and regional responses.
There is another thing that affects the world and this region as well, and that is drug trafficking. A lot of people traffic drugs directly or indirectly, and the communities as well as the organizations that control it here in Pakistan have been working diligently along, I'm sure, with the UNODC. What new measures should be taken in your point of view? Because the methodology of those involved in drug trafficking changes from time to time and updates itself. Do you feel that the UNODC and the governments, different governments, including the government of Pakistan, are also updating their methodologies as far as to combat these?
Yes, absolutely. And I think at the outset here, I have to, praise. I have to praise the efforts of the government of Pakistan. The Ministry of Narcotics Control, the ANF on the front lines on the border with Afghanistan, and many law enforcement agencies. I mean, Pakistan's one of the 2 highest countries in the world in terms of seizing drugs. Those drugs that are seized here weren't destined for Pakistan, but other parts of the world.
Of course.
So if Pakistan, seizes drugs here, they're protecting drugs harming the rest of the world, and many pay the ultimate sacrifice. There's quite a loss of life in this battle and this struggle.
Because a lot of money is involved. People people sell drugs because the rate of profit is extremely high.
Yeah, and so your question was on what are we doing?
Exactly.
Are we adapting?
How are you updating your methodologies? Because we see the people involved in drug trade or even crimes update the way they do it.
Yeah. So. Yeah, absolutely. We do a lot of technical assistance and on many fronts. Since the COVID-19 pandemic, we've seen larger shipments. We've seen more use of trying to traffic through Pakistan and Iran to the maritime realm. So we do a lot of technical training. We do a lot of bringing countries together to share information on drug cases and on methods of concealment. So that countries are up to date on what trafficking networks are doing. We're working more with ANF and the Coast Guards and the Maritime Security Agency and Customs, for example, on the maritime realm, on coordinating responses to respond to that new trend. We're also, when you look at drugs and crime, a lot is going into the cyber realm.
True.
And so, there's increasing use of social media, deep web, the dark net
web
to traffic drugs. And so, we're addressing this as well with specialised training and techniques. UNODC, a lot of what we do is technical training. And
I think that's very important because, you know, I've heard stories about people using gaming platforms and using the chat during these gaming platforms in order to traffic drugs and, you know, traffic crime, and so that it goes without, you know, being properly monitored. Do you feel that needs to be monitored on a large scale as well?
Yeah, there's a lot of complexity when it comes to cybercrime and how drugs are trafficked and how crime is perpetuated. And so we do have a package of sort of different types of training, how to use electronic evidence in drug cases. So in partnership with the Ministry of Foreign Affairs and other partners here in Pakistan, Pakistan was the first country to launch a tailored electronic evidence guide for the Pakistan situation based on a new global, you know, investigative technique. And so there's a lot to do. I don't want to place any illusions that we're on top of it. There's a lot to do, but in terms of conducting online investigations, going undercover online to investigate, you know, drug offences through the various social media or dark web. As I said, how evidence is collected, working with social media platforms and service providers to, you know, preserve evidence and help with investigations. We have a whole package of training and techniques which we're starting to work on here in Pakistan with the key partners. So it's complex. There's a long way to go, but it's an important area and it needs to be addressed.
And of course, it needs to be addressed. And the fact remains that the more you address it, the more you understand that there are other things that you need to cater to, and the more difficult or complicated it becomes. But this is a journey that one has to take, and this is what the UNODC is doing along with Pakistan and along with so many other countries across the world. One of the key messages this year is hashtag care in crises. What does that mean exactly? What do you mean by care in crises?
Well, I mean, I touched on that earlier, that you know, in times of hardship, people might be more subject to take risks of drugs, and also that it may be harder to access services. But it's really about, you know, ensuring that the services are there, that people who need drug treatment, that we don't treat them as victims, that it's a multifactorial health disorder, that they're able to access the care that they need. And that people understand the problem and are supportive and can help build and create an environment where, you know, people can be assisted, and that we can then focus on the criminals that are you know, creating the hardship and perpetrating the abuse, while at the same time protecting people who may be you know, become addicted to drugs.
I think that's very important, Jeremy. It's very important for the people who are involved, for the people who are susceptible to it. And I think it's a joint effort always. You can't say that it's the UNODC that's doing it. Without any government of a country, the UNODC cannot function on its own. Without also the involvement of the private sector, the UNODC cannot function. So there is a huge collaboration between the public, private sector and the United Nations Organization on Drugs and Crime. Now, the World Drug Report 2022 was launched on the 27th across the world, on the 29th in Pakistan. Every year you take out a drug report with the salient features about the respective country. What are the salient features this year as far as the World Drug Report 2022 are concerned? Okay,
well, yeah, as I said, the World Drug Report each year gathers data from all over the world on drug trends, on abuse and challenges, and we put it in a report. This year it's in 5 volumes, so we have a nice summary. The first volume is very thin and summarises everything in the other 4. So I would encourage people to look online, to visit our website and to see that and familiarise themselves with that.
What are the different findings of this report, Jeremy?
Well, there's immense findings. So I mean, I have some of them here. I mean, there continue to be high levels of opiate abuse around the world, but the abuse of synthetic drugs is increasing. there's a high prevalence of HIV and disease among people who inject drugs. So it's still a serious problem, and in fact, in some areas, getting worse. And that applies to seizures as well. Most seizures are the plant-based drugs, so the opium, the cannabis, the cocaine. But again, synthetic drugs are increasing in terms of seizures and in complexity. I talked about, Pakistan's role before. Afghanistan is still producing 86% of the world's illicit opiates. We report on the production there. So the production area last year was down by 16%, but still 246,000 hectares. But the yields were higher, so the actual production was up 7%. So there's very high volumes of drugs being produced. And it's important to mention the synthetic drugs. The synthetic drugs are spreading over the world. Afghanistan was traditionally producing most of the illicit opiates, but now it's a big producer of amphetamine-type stimulants. And it's not just this region, it's around the world. So 5 years back, I think just over 80 countries had seized synthetic drugs. In the last 5 years, it was 117 countries. The survey shows that 34 million people used amphetamine-type stimulants. 20 million of those used ecstasy. And most drug users are men, but the proportion of women using drugs is growing. And when it comes to synthetic drugs, the proportion of women as drug users is quite high, 40%, and women need particular care. So cocaine was also a record high, unfortunately, last year, up 11%. Over 1,900 tonnes were seized, and there have been seizures in Pakistan as well. So yeah, and the overall figures in the last year, 284 million used at least one substance. That 40 million people globally will then need treatment. And this is in the last decade. This is a 26% increase over the previous decade. And it's such an incredible burden on health, on economies, on society. So of that, 209 million people used cannabis, 61 million people used opioids. That's like 1.2% of the world's population. And opioids are still accounting for most of the deaths, 70% of deaths related to opioids. And there's many facts. The readers can log and see this. I guess the other important fact, 11.2 million intravenous drug users globally. Almost half of those, 5.5 million, have hepatitis C, and 1.5 million of those are living with HIV. So it's remains such a big challenge. And then the report also this year has some other themes. It looks about drugs and conflict, how synthetic drug manufacture is growing in areas of weak governance and where there's conflict. It's looking at the questions, cybercrime and social media that we discussed before. And also this year there's a chapter on the environmental footprint. Production of drugs has a high carbon footprint and is extremely damaging to the environment. So there's a whole range of themes, statistics, which are there in the report and very well summarised in the first volume. So I'd encourage people to read it.
All right, I think it's the report details a lot of important things, and we're going to discuss some of those factors, but we have to go to a short break. We'll be back right after. Stay tuned. Welcome back. You're watching Diplomatic Enclave. I'm here with Jeremy Milsom, who's the country representative for UNODC, the key organization under the United Nations that deals with drugs and crime. And we've been talking about the World Drug Report that has come out on the 27th across the world and the 29th in Pakistan, as well as the different statistics that Jeremy has quite ably mentioned. It's a 5-volume thing, so all you need to do is go online to the UNODC website and just look at it, because it's highly researched. It talks about the world, it talks about Pakistan, and it talks about the different issues that pertain to drug and crime use. Jeremy, before the break, you were talking about, in fact, HIV users and drugs, and how a lot of drug users are getting HIV because, of course, HIV gets transmitted through the use of the used syringes, amongst other things. Why is the world not being able to control that? HIV is nothing new. It's not a new disease. It's something that has been rampant in the world since the 80s. Nevertheless, we are here in 2022. And even developed countries haven't been able to control the spread of HIV within drug users. Why is that?
I think a lot of it has to do first with access to treatment and also stigma as well, where people using drugs might be seen as criminals rather than people who need, health support. A key to addressing, HIV among intravenous drug users is people being able to access services, services, and being able to work with those addicts to, give them safe treatment. If they have access to safe treatment, then they're less likely to go onto the street and get, try to get hits of drugs with dirty needles. They can be protected, they can be cared for, and the HIV won't be transmitted. And in fact, Pakistan has made excellent progress in this field in the last, I'd say, 2 years, 12 to 18 months. The Ministry of Narcotics Control, working together with the Ministry of Health and the ANF, are working on a number of fronts. One is on setting up a new regulatory framework for drug treatment in the country and expanding services. So, one of the problems here has been there hasn't been continuity and conformity and, consistency in the quality of services provided to addicts. And this new policy and document will help change the way drug treatment is provided, the scope of it, and more in line with international, health standards. So, this is a great progress. And the other one is medically assisted treatment, opium agonist treatment. It's evidence-based treatment that's used all around the world in most countries in the region, and Pakistan is going to roll out more dedicated treatment in this respect. And then again, it's about people getting access to treatment and being treated as having a health disorder, and then they don't have to go on the streets, and then the risks of transmission then are much lower. And we partner with UNAIDS, with the World Health Organization, all over the world on this issue, and I think in the last 12 to 18 months there's been great progress here, and hopefully when we conduct new surveys we'll hopefully see a difference.
All right, Jeremy, you talk to access to health services, you talk to people going and getting themselves treated. A lot of that is also correlated with the social environment of any country, including that in Pakistan. A lot of countries, including our own, are very conservative when it comes to the telling of to people or to the health service people about their son or their daughter or their father or their brother being a drug user or being involved in crime. There's a lot of social stigma that is attached to that, and due to that a lot of drug use and a lot of crime goes unchecked. Is there any means to go above and beyond to make people understand that it's important for them to come out in the open, at least to tell the services that are working in this respect, so that they can control, curtail or heal those people who are involved in it?
Yeah, and that's a problem we face all over the world, and it really needs a paradigm shift, so that again, UN officially, the United Nations officially classifies drug use disorders as a multifactorial health disorder. So there's many factors which can lead to it, and many which are out of the control of the individual. So it's a health disorder, so we treat the person as a patient, not as a criminal. So in terms of changing the way people perceive it, that takes time, and a lot has to do with education. In partnership with our counterparts in government, and as I said, UNAIDS and the World Health Organization, and UN Women as well, we've been doing a lot of advocacy events around the country. So we've had awareness raising, open discussions, forums with government, with civil society, with the private sector, talking about this issue, helping people understand the United Nations position, that it's a health disorder, and all the evidence that behind that, and why we treat it that way, and the difference that it makes. It really can make a society safer, healthier, happier if we follow these international best practices and standards. So, there are efforts underway. Changing mindsets and stigma takes time, but I think it's a worthy goal.
I'd like to understand 2 points concerning drug production and drug usage. There is a myth, I don't know whether it's a myth or reality, that goes that drug production is mostly concerned with the lower middle class, those who want to get a lot of money or make money, and drug usage is mostly amongst the elite class, especially the synthetic drugs. How much of that is true?
Well, no, unfortunately, drugs are used by people from all socio-economic backgrounds, so anyone can be vulnerable or susceptible. Here you may see usage among elites, but you'll also see usage among, very poor villages, who are struggling to, who are on the sort of poverty line. So,
of course.
That there's no sort of truth that everyone's susceptible and everyone can be a user. Then I guess when you talk about the people producing the drugs, there is a bit of a difference than when you talk about opium and synthetic drugs. Because the opium, unfortunately, many people are dependent on that as their primary means of earning money and getting food in their mouths in Afghanistan. And that's why there are big, what we call alternative development programs, where we work with farmers to help them develop food crops and other crops to get income.
Is this still continuing in Afghanistan?
Yes,
this
it's
work?
still continuing.
Okay.
As you know, there's a humanitarian crisis in Afghanistan. There's a lot of people suffering. Agencies such as the World Food Programme and UNDP are doing aid and development around the country. UNODC is also part of that partnership, doing what we call alternative livelihoods around the country. But producing synthetic drugs is a criminal enterprise. It's greed, and it's the big criminal networks. There's big profits to be made, and so it's different. You don't have that factor where people are dependent on it for their survival and livelihood. So the two types of drug production need two different approaches.
All right. Now, speaking of approaches, let's localize it a little bit to Pakistan, and let's talk about the responsibility of organizations such as the Anti-Narcotics Force or the Ministry of Narcotics Control or the Ministry of Health. How much do you feel are they doing their work as far as drug control or crime control or the interrelation between the two is concerned? Do you feel more needs to be done, and if so, if there are certain lacunas or certain things that need to be worked upon, could you highlight them as well?
Well, I think I see absolute commitment in our partners, and I think they're doing as much as the resources they have allow them. I think one of the problems is it's such a big problem compared to the resources available. That we always struggle, to get enough resources to address the problem. I know that the ANF, the Anti-Narcotics Force, and the MNC and the Ministry of Health have concrete, clear plans that are in line with international standards and obligations to do more on tackling the drug problem in the country, but it's all a question of resources, having the resources to be able to do it. But there's commitment there, and there are plans there, and we hope to work in partnership with them to realise this. Ourselves too, we need to we've developed a new country program in partnership with our counterparts here in Pakistan. We've talked with ministries, so many ministries at the federal level and provincial level that we work with. We've crafted this program reflecting national and regional priorities. It has a large budget and we need to fundraise for that. So, you know, we don't have the money to do it, and we need to highlight the problem, highlight the need.
When you talk of fundraising, you know, the United Nations also works on these funds. Different important countries across the world fund the United Nations and its different organizations. Do you feel under the current geopolitical or geostrategic environment and the economic crisis that is engulfing the world, these countries are still funding the United Nations and UNODC?
Yeah,
in the same way as they used to do.
And I think our Secretary General laments this issue, that there are just so many crises and conflicts in the world, and you know it creates a challenge in terms of being able to, you know, there aren't enough finances to address all the needs.
So I think it needs to be a common commitment between the different governments where UNODC is working, or the United Nations, other organizations are working, and the private sector as well. I think the role of the private sector is paramount in it as well.
Yes, yes, absolutely. I mean, the issues we address, drugs and crime and terrorism, they undermine development. You know, they act as sort of a brake on social and economic development. Criminal proceeds is money which, you know, is sort of taken out of an economy which should be there, benefiting economy, benefiting development.
True.
So it's a cross-cutting and integrated issue, and one, you know, we really need to highlight those linkages and understand the negative impact, you know, it can have.
That is true. Coming back to Pakistan, the UNODC, that is the UNODC Pakistan that you are heading, has also launched the third phase of the country program for Pakistan, that is between 2022 and 2025. Could you highlight some of the important features of this third phase?
Yeah, well, absolutely. The first point I'll make is UNODC has perhaps a bigger hat and mandate than people realise. We have, you know, 5 thematic areas globally, and the first of those is the world drug problem. So most of what we've been talking about on interdicting drugs, on prevention and treatment, comes under our first pillar. But our second pillar is transnational organised crime, and that's, you know, all forms of crime, maritime crime, human trafficking, illicit financial flows, cybercrime, environmental crime, trafficking of cultural relics. All this, UNODC is responsible for many conventions, instruments, treaties related to this, and our work is to help countries address these problems. The third pillar is corruption and economic crime, where the Secretary of the United Nations Convention Against Corruption. The fourth pillar is counter-terrorism, which we do from a criminal justice point of view, in helping countries investigate and prosecute and protect in line with international human rights standards. And the fourth pillar, crime prevention and criminal justice, this has a lot to do with outreach, with access to justice, with working in prisons and improving prison conditions. So we have a very broad mandate indeed. And we've worked closely with the government to develop our new country program. And so we're addressing many of these areas. Our first pillar is on border management and crime prevention, and we'll be working, you know, working with ANF on technical capacity building, on strengthening the response on maritime crime, on human trafficking, on cybercrime. This is the first pillar. The second pillar is our rule of law and legal cooperation of our country program. So strengthening, you know, police responses, police and judicial systems working together to make safer societies, working on the whole challenge of illicit financial flows and the risks and loss that presents to governments. Our third pillar is similar to our first pillar, so it's the prevention and treatment. We have a dedicated pillar on the prevention and treatment the HIV among intravenous drug users issues we addressed, and our fourth pillar, counter-terrorism. So, you know, we've launched this program, we've designed it in partnership with government. So it reflects national and regional priorities, and you know, we hope we can, you know, implement a lot of the goals that we've laid out in that program.
This is the third phase, Jeremy. So how would you relate to the outcome of the first two phases of the Pakistan program that the UNODC launched? Are you happy with the outcome of the first two phases?
Well, I think the thing with the United Nations system is you have, you know, some things work well, some things work not so well.
Of course.
So we have a lot of achievements, and we've produced some publications which people can access, which show those achievements, and not only said by us. We've got a book of impact stories from people who've been participating in our programs and what it's done for them. But you know, you monitor and you evaluate and you learn as well. Okay, what we did last time, how do we do it better in the next phase? So we in fact conducted a very in-depth evaluation, independent evaluation of the last phase, and that also contributed to the design of the third phase. So, you know, there are some achievements. We learn the lessons of the things we can do better, and we improve them. And this is a cycle which the UN system implements to ensure that, you know, our assistance is targeted and effective and
so many important phases, Jeremy, you know, counter-terrorism or corruption or drug usage or crime related to drug use or not related, but of course there's always an interrelation between the drug usage, drug production and the crime rate as well. When you look at how productive the cooperation between Pakistan and the UNODC has been in the past and how it's going to go in the future, what are your expectations in the next few years from Pakistan as a government, from Pakistan as a partner of UNODC?
Well, again, it sort of goes back to the funding question. There's a lot we want to do, that government wants to do, that we hope we can fund. So, you know, if we get the funding for the program, we can implement the goals of the program. You know, as with all UN agencies, we advocate to government to itself, you know, commit the resources, human and physical, you know, more resources to the issue. In the long run, it's of great benefit to the country because the costs to Pakistan of drugs and crime are immense, and you know, it's investing in this area gets returns for the country. So you know, I think all agencies in their thematic areas would encourage, you know, more you know, national contributions as well.
And cohesion between the different organizations, public and private sector, and of course with the United Nations as well. Jeremy, finally, what would your message be to the Pakistani youth, to the Pakistani public, and all of those who are watching this show as far as the UNODC's work? Any specific thing that you'd like to say through our platform?
Well, I think the most important thing after all we've discussed is people need to understand the issue. They need to understand it, how it relates to them, and you know, how they can contribute. So you know, UNODC has a lot of resources. We release this report every year. We have this nice summary report. You know, people need to be educated. They need to understand the risks, that the harm it can cause to them and the people around them, and you know, do their part to advocate for you know, society to work together on the issue. You raised that, you know, that point before, that some people may be thinking that drugs aren't dangerous.
Of course.
Well, you know,
all drugs are dangerous.
There's a start. The synthetic drugs coming onto the market are very dangerous and can, you know, cause extreme harm and break apart families. So it's you know, really, you know, learn about the issue, understand the issue, advocate as you can in where you're working, be it, you know, government or schools or in the private sector, and you know, then if we have that strong awareness, we can all, you know, make a difference together.
That is so important. I think awareness is the key word that I'll take it. Awareness for the usage of drugs or of crime. Awareness if you find that somebody in your family or friends are taking drugs, how to help them stop the use of drugs, and if they are involved in certain crimes, if you also find people involved in corruption in your family, in your friends, how to also stop them. Awareness, I think, is a very, very important key word in all of this. Thank you so very much, Jeremy Milsom, Country Representative, UNODC, to have come to our show and to have talked about the World Drug Report that you've just taken out, and also the third phase of the country-specific program that you are also launching for the year 2022 and 2025. It's very important. The conversation is not only beneficial for the people who are watching, but also extremely important to understand, to make them aware. With that, ladies and gentlemen, we come to an end of today's Diplomatic Enclave. We'll see you inshallah next week with another guest. What you need to do, and what the takeout, if I were to understand it, is that you need to see around, be more aware, think and look around as to who might or might not be susceptible to drug use, susceptible to crime, and susceptible to both of these things, or even corruption, or even, you know, if you feel there's something happening in your neighborhood, amongst your friends, in your family, or around you, that you need to make aware the different organizations that are concerned with it, whether it be the UNODC, ANF, Ministry of Narcotics Control, or the Ministry of Health. Do that, you know. You can do that in whatever manner you want to. There's a whole website of the UNODC that you can go to and look at the different precautions that they put forward. If there's any question that you have, you can also always go to the UNODC website and see if there is answer to that. Otherwise, I'll always be there to refer your questions to Jeremy Milsom, and I'm sure he'll be giving an adequate answer to that. Be aware, do not use any form of drugs, because as Jeremy has indicated, there is always a dependence, whether it be personal, whether it be monetary, or whether it be social. And of course, all of this is also related to drug usage, this is related to crime, this is related to corruption, and this is, you know, all of this is a huge web of deceit and crime that goes unstopped if you don't take the necessary measures. Allah Hafiz, and stay aware. And thank you very much, Jeremy.
Yeah, thank you. A pleasure to be on the show. Thank you.